surprised that DBM and I guess the OP, and in fairness to them, they decided to apply pa rin yung rules on emergency procurement that you find under 9184. Para rin merong sistema rin siguro dun sa pag-procure and to ensure accountability as well. So nung ni-request ng DBM yung joint circular niya yan, I think part of the reason was also to put our auditors on notice na emergency procurement rules dun sa pag-procure nitong mga PPEs and the like. So I think that was the main purpose po.
So in effect, Chairman, nag-iingat din sila. They're aware of the existence of Republic Act 9184. They're aware of the consequences if they make some missteps relative to Bayanihan 1. And the same is true with Administrative Order 17, Series of 2011. So sa nakita po natin, Ms. Ruiz, you can answer, and Yusek Lau, you can butt in. Napabilis yung pagbili nila, na-download yung funds. Nakikita nyo po ba, dahil ang definition nga ng common use supplies and equipment ay yung marami ang gumagamit para sa ahensya, nakikita nyo ba yung pagkakataon na pati itong mga vaccines natin, gawin na rin natin common use supplies and equipment para mapabilis? Kasi ito yung purpose nyo mabilis yung pagbili nang sa ganon magamit agad. Nakikita nyo ba yung darating yung panahon na alisin na natin yung tripartite agreement, ilagay na lang dito sa PSDBM kasi gusto nila mabilis at sinasabi nyo naman mabilis talaga sila. Nakikita nyo yan, Ms. Ruiz and Yusek Lau?
Mr. Chair, if I may respond. Concerning po dun sa vaccines, nagkaroon din po ng request ang Department of Health sa GPPB na gawing common use supplies ang vaccine. At that time po, ang nagne-negotiate na po for the procurement of vaccines would be the National Task Force. Kaya po nung nakuha namin yung letter from the DOH requesting for that, ay humiho kami ng clarification sa kanila kung ano po ang magiging role ng procurement service. Doon po kasi sa una nilang request for the COVID-19 items, klaro po na ang bibili, base sa kanilang request, ay ang procurement service, kaya po siya nire-request na maging common use supplies and equipment. However, on the other hand po, yung pong vaccine kasi, at the time po that the request was made, the vaccines were already being negotiated by the National Task Force. So aware po kami na meron na pong entity, which is the National Task Force, base po doon sa mga press release na nakikita namin at the time, na siya po ang nag-negotiate for the eventual procurement at nag-enter po ng mga tripartite agreement. Kaya po namin tina-clarify lamang kung ano po ang magiging role ng procurement service kasi hindi naman po sila ang bibili. In this case po kasi, as you've noted, iikot po kasi yung proseso. Unlike po in the first case, nabibili na po diretsyo ng procurement service in bulk. So mas mapapabilis po dapat at dapat po mas mababa ang presyo dahil mas marami pong binibili. In the case of the vaccine, ang mag-negotiate po ay ang task force tapos po ipapasok po yung procurement service. Kaya po minabuti namin i-clarify ano po ba yung eksaktong magiging role.
We understand, ma'am, kasi itong face shields, face mask, and even testing kits na kasama sa common use supplies and equipment ninyo are considered medical devices, which under FDA law is even under the Department of Health. So, move na po ako doon. Si Secretary Duque, papayag po ba kayo na mapunta sa PSDBM ang purchasing, ang procurement ng vaccines? Briefly, isang tanong pa ako sa kay Yusek Lau before I turn this over to Senator Bato de la Rosa. Secretary Duque?
Meron na kasi tayo ngayon nakatalaga na proseso at
Yes.
maayos
So,
naman.
we stick with that. Siguro
Yes.
sa inyo. Kasi yung iba nababagalan siguro sa pag-procure, lalo yung mga local government units. So nakita ko lang na ito yung pagkakataon na baka pwedeng isama dito sa common use supplies and equipment category na kung papayag kayo, wala pa tayo nakitang other justifiable reasons except that there is now an existing practice. But the practice before, face masks and face shields were not included in the CE common use supplies and equipment. So, in short, hindi kayo payag. Last two questions ako kay Yusek Lau. Yusek Lau, are you still there?
Still present, Mr. Chairman.
Yusek Lau, nung tinanggap niyo po itong mga papeles ng Pharmally, pumasok ba sa isip niyo na kahit walang requirement ang batas, dapat nyong hingin. Halimbawa po, hingin yung mga datos tungkol sa financial capability ng family. Pumasok ba sa isip niyo yun?
As an extra precaution po, it has been made a standard for our team to request certain documents, even if it's not required by Bayanihan 1, like the ITR, mayor's permit, omnibus sworn statement, and the compliance with the technical specification that we are actually items that we are procuring. So,
So
kahit
pag satisfied na kayo, okay na sa inyo. Kahit lumalabas ngayon na medyo mababa yung capitalization. Requirement ba na kailangan mataas din yung capitalization?
Under Bayanihan 1 and under RA 9184, it is not required, Mr. Chairman. However,
You're a lawyer, Yusek Lau. There is such a principle in civil law, caveat emptor. Let the buyer beware. So,
yes,
hindi ba tayo nag-take ng konting precaution? Alamin, qualified ba to or sufficiente na yung natanggap mong datos?
two things, Mr. Chairman. One, we ask for documents which is not required by law as a measure of diligence. Second point, we took additional precaution despite having these documents already on our hand. We also made sure to protect the interest of the Philippine government's money. We did not make advance payment when we procured this item. So under Bayanihan 1, we can actually pay in full, pay in advance, but we were so cautious that we added several measures in our practice to make sure na protected ang government. And they, like this one, Farmally, or and other, hindi na kasi sila, other local suppliers, we did not make advance payment. That is very crucial. Kasi in other contracts in the government, kasi when you put, di ba, down payment, yung mga bidding kahit saan, kahit sa DPWH, meron silang AAA, quadruple A, nagbabayad ng 15% down payment, yun biglang nagwawala kahit pa may office, may capital, may AAA license. So during the time, emergency, we were very cautious that that is a possibility na pag nagbayad kami, baka mawala ang pera. So what we did is, we don't give down payment. You deliver first. After you deliver, we inspect first. After we inspect, we ask the end user entity, which is the DOH, to accept it first. Pag na-comply nila ng tatlo, and pag na-comply nila etong tatlo, saka kami magbabayad. So with that,
Yusek Lau, if I may abruptly interrupt you, lahat ba ito na-deliver naman? Na-inspect naman?
Yes.
Kanina I heard the word quality. Was there a quality inspection done
yes,
in accordance
Yes,
with existing procedures?
yes po, we have standard one, we have the quantity inspection, inibilang namin quantity. We also have the standards of quality. We also use yung mga testing requirements na required by law. And in fact, DOH does the test and inspection together with DSDBM jointly. I think, alam nyo naman, during that time, we were able to deliver those items through Secretary Dalvez and NTF, IATF to the doctors and the nurses. And we were so happy last year that they had a positive review and response to the use of the items that was procured by DOH through PSDPM.
Last question, Yusek Lau, alam ko lawyer ka, there is also such a thing, a principle as piercing the veil of corporate fiction. So kung hindi nyo trabaho na alamin kung sino yung mga incorporators, hindi karagdagan trabaho na yan, were there steps taken? And siguro looking forward, baka mag-propose na lang ako ng amendments na dapat magkaroon din kayo ng rating. Sino yung mga na-blacklist, sino yung 3-star, 2-star. So nagawa niyo pa to na taking steps beyond your functions, ni-review nyo kung sino yung mga incorporators nito, nasaan sila. Kasi nabalitaan ko, yung iba hindi makita yung address. Meron tayo ngayong kaharap, nasa Singapore. So, nagawa niyo ba yan?
Under Bayanihan 1, Mr. Chairman, during that time, it was not required by law, so we did not do it. However, we asked for basic requirements like the mayor's permit and yung ITR nila as proof of their existence and operations like the omnibus sworn statement. We took it on face value because these documents were issued by government agencies as well. As to what are behind those documents. Wala na po kami oras and hindi po kasi siya required ng batas.
Because of the emergency. Because of the
Yes po.
emergency.
Yes
So you complied what is being asked of you by existing regulations, bayanihan law. Ang nakikita ko rito po, Mr. Chairman, gaya po ng yung hindi ko po pagkagusto sa ilang mga implementing rules, siguro dapat tingnan din natin, hindi lang ang ilang ahensya, minsan nababago yung implementing rules, not in compliance with the existing law. So, Mr. Chairman, I have no further questions. I yield the floor to my seatmate here, Senator De La Rosa. Maraming salamat sa Yusek Lau, Ms. Ruiz, Chairman Aguinaldo, and Secretary Duque for your candid and honest responses.
Mr. Chairman, just a quick manifestation, very quick, Mr. President. Mr. Chairman.
Go ahead, Senator Pangilinan, very quickly.
Just to place on record, Mr. Chairman, the earlier answers of Mr. Lau, he said that we were very cautious, and this is a 180-degree turn from his previous manifestation that perhaps there was a possibility that there was negligence on their part. Just for the record, Mr. President, nagbabago yung storya.
Mr. Chairman, in response, we just like to state that
That is already taken cognizant of by the chair and by the committee. Last time he said he may have been negligent or words to that effect. And today they were overly cautious. Go ahead. Let me call Senator De La Rosa, please.
Thank you, Mr. Chairman. Can I direct my questions to the Secretary of DOH, Secretary Duque?
Of course, please go ahead.
Secretary Duque, good afternoon. For the
Good
record,
afternoon.
for the record, Secretary Duque, tayong lahat dito ay naghahanap ng katotohanan. Kaya tayo nagkakaroon ng hearing dahil gusto natin matumbok yung katotohanan. Yung chairman natin, si Senator Gordon, gusto niya matumbok ang katotohanan, and I am with him in searching for the truth. Lahat tayo dito, si President Duterte gusto rin malaman ang katotohanan dito sa mga issues na ito. Kaya wala akong pakialam kahit na sabihin ninyong ako'y kaalyado ni President Duterte at ikaw ay very close kay President Duterte. Kung ang lalabas na katotohanan ay dapat ikaw ay managot, then dapat pananagutan mo. Pero kung ang lalabas na katotohanan naman ay you are wrongly accused or you are wrongly crucified, andito rin ako para duwipinsa sa'yo. Basta sa atin lang yung katotohanan. In fact, Secretary Duque, for the record, I was one of the senators who signed the resolution for urging you to resign from DOH during the initial stage of the pandemic, because I was very much dismayed with your initial response to the contact tracing of the two Wuhan couple, yung mag-asawa, first COVID cases dito sa Pilipinas. So, for the record lang, Secretary Duque. So, my first question, Secretary Duque. Totoo ba na may biniling PPE seats noong 2015 at 2016? 1 week bago magtapos ang term ni dating Pangulong Aquino at na-plug ba ito ng COA as overpriced?
Thank you, Mr. Chairman. The answer to that is yes. At yun po ay na-procure ng DOH for CY 2015 and 2016. At ito po ay nabili through public bidding with a contract price of 11.4 million thereabouts and 15 million respectively. So, yun po.
Ano ang mas mataas na presyo? Para tuloy-tuloy tayo. Yung PPE na binili noong 2015 at 2016 or yung nabili noong 2020 nung merong COVID-19 pandemic at kulang na kulang ang supply at napakataas ang demand? Anong mas mataas ang presyo?
Yung pong binili natin na PPE na mga mababa sa 2,000 piso kada PPE set ay may kasama pong 9 hanggang 10 na mga components. At ang mga components na ito in terms of quality and specifications halos pareho din naman nung mga PPEs nung binili 2015 and 2016.
So yung diferensya ng presyo, magkano bang diferensya?
Halos lampas mababa sa kalahati kasi kung mga 1.9 at saka yung unang binili na 3,500 per PPE set of 8 components compared to the 1.7 or 1.9, basta less than 2,000 po yun na PPE binili ng kasalukuyan administrasyon na may 9 hanggang 10 na bahagi. So, yan po, malaki po ang diferensya, 3.5 compared to about mga 1.9. Thank you.
So per your knowledge, kung hindi na flag na overpriced yung 3,500 at 3,800 noong 2015 at 2016, hindi din dapat sabihin na overpriced yung presyo na mas mababa ng kalahati dyan sa presyo na yan na may pandemya pa.
Mr. Chairman, mahirap hong sabihin na may overpriced noon kasi iba-ibang panahon, iba-iba ang supply chain adequacy. So, masasabi lang namin na sa panahon na iyon, yun lang ho yung presyo. At kung ito ba ay overpriced, ay kinakailangan magkaroon kami ng ebidensya para sabihin na ito nga ay overpriced at bukod doon, ang COA, wala din naman silang findings. Tinignan namin na nagsasabi na ito ay overpriced. Salamat po.
Kaya nga, gusto kong ikumpara. Dahil ngayon, you are being accused of overpricing. Nung bumili kayo ng mga PPE at the very start of the pandemic, kung saan nagkandarapa tayo ng supply, ang demand napakataas dahil sabay-sabay ang pandemic, buong mundo, tapos ang supply ay napakababa dahil nga nabigla tayo at biglang nag-lockdown, walang nagtatrabaho sa mga factory, bumaba ang supply. So, the law of supply and demand applies na talagang tataas ang presyo sa panahon na yon. Then later on, the law of supply and demand naman also dictates na kapag mataas ang presyo, dadami ang supply. Kapag dumami ang supply, bumaba na naman yung presyo. So, may kanya-kanyang interaction po yan. Kaya, kinumpara ngayon yung presyo ng initial ng pandemic at yung later na naka-recover na yung mga factory nakapag-produce na, bumaba na yung presyo, kinumpara kaya sinasabi na overpriced kayo. Kaya nga, ikukumpara ko naman ngayon, yung panahon nung walang pandemic, na 3,500 at 3,800 yung isang unit ng isang set ng PPE. Kumpara ngayon, magkano presyo ng nabili nila? Ninyo? 1,000? Yung 2020, magkano ang nabili niyo? Magkano ang per set?
Ang price range po na nabili is about 1,470 to about 1,980 pesos per PPE set. So talagang di hamak na mas mababa ang presyong ito kumpara doon sa presyo nung kanilang binili noong 2015 and 2016.
Yun nga, napakalaki ng diferensya. But anyway, gusto ko lang maklaro yan, ma-sit natin yan, ma-establish natin sa committee na ito. Yung sabi mo kanina, 8 pieces lang yung sa 2015 at 2016. Itong 2020 na mas mababa ang presyo, 9 pieces or 10 pesos. Anong diferensya doon? Anong piece lacking doon sa 2015 at 2016?
Yung pong sa 2015 and 2016 procurement ay hindi po kasama ang face shield at saka apron. So yun po ang diferensya. 10 ang components nung binili ng kasalukuyang administrasyon kumpara doon sa nakaraan 2015, 2016 na 8 ang components. At wala nga doon yung face shield and apron.
Excuse me, with the permission of Senator De La Rosa, magulang galang lang po.
Yes, sir.
May announce lang po si Senate President Soto. Senate President Soto is recognized.
Thank you, Mr. Chairman. Considering the importance of the hearing being conducted, and I know that that there are time constraints, I will convene the session at 4 p.m. So you can go on with your hearing, Chairman, Senator Gordon, and then perhaps just a point or two after Senator De La Rosa, if you don't mind.
Yes, sir. The Senate President is always ready, will always be recognized in spite of the line. Thank you, Mr. Senate President. Attorney De La Rosa, may continue. Just kidding.
MA lang, sir, MA. Kung sa Bisaya, murag attorney.
Murag attorney.
Murag attorney sa Bisaya, MA.
Kadyot lang, kadyot lang.
Kadyot lang. Thank you, sir. Thank you.
Thank you.
So, if I may continue, Mr. Chairman, to
Please go ahead.
Secretary Duque. So, kung yung binili nung 2015 and 2016 ay 8-piece set, 8-piece set lang 8. Tapos, yung binili nung 2020 ay 9-piece set, 9. Tapos, mas mura pa yung 9-piece set sa 8-piece set. Tapos, meron pang pandemya nitong 2020 at kulang na kulang ang supply. Siguro, hindi pwedeng sabihin na mayroong overprice noong 2020 dahil noong 2015 at 2016 walang sinabing overprice. Again, pure own opinion lang. Hindi ka naman kuha Pero opinion mo lang.
Tama po kayo, Honorable Senator Bato, Mr. Chairman. Kanya kinakailangan talaga ay humantong sa tinatawag natin apples to apples comparison. So yun ang tinitignan natin at yun po ang aantayin ko na resulta ng pagsusuri. Kung ano ba, baka kasi may mga ibang katangian na andun sa isa, wala naman dun sa isa. At kagaya nga ngayon, itong sinasabi natin, may dalawang bahagi o components na wala doon sa procurement ng PPEs in 2015 and 2016, pero andito ngayon doon sa atin mas mababang presyo na binili yung face shield and face mask nakasama. Kaya naging 10 ang bahagi o components.
Yes, I don't really agree with you na pag sinabi mong we cannot compare, parang ikumpara natin to sa comparing apples to oranges. Ang sa akin dito is comparing apples in January and comparing apples in December. Parang ganito ang comparison dyan. Hindi, kasi parehong pipi yan So hindi orange at saka apple yan. Apple to apple. But anyway, thank you very much, Secretary Duque. Mr. Chairman, can I ask questions to Attorney Lloyd Lau from PSDBM? Are you still around, Mr. Lau?
Yes, Mr. Chairman, still allowed, Mr. Chairman.
Thank you. Thank you, Mr. Lau. My first question is, nagbayad ba ng advance payment sa Parmale bago ito nag-deliver ng PPS sa DOH?
Hindi po. Despite na we are authorized to make advance payments, we constrained ourselves from paying advance payment. In fact, we only paid full payment to Farmally after full delivery, after inspection, and after acceptance by DOH. So we have to finish everything before we pay them in full. There was never any advance payment on our part. So if they won't deliver, no money is lost on the part of the government, Mr. Chairman.
I beg the indulgence of Senator De La Rosa again, with your permission, sir.
Yes, sir.
Let me just tell Mr. Wang that I got in touch with the embassy already through one of my staff. Consul General has asked you to proceed to the embassy. All you have to do is go straight to the Consul General's office. He will be waiting for you. His name is Adrian Candolaba, so the oath can be administered to you.
Yes, Mr. Chairman.
Post days, I don't think it's Singapore is not that big a city. I think you should be able to do that right away. And you've been there, I'm sure, to get your passport coming here, right?
Yes, Mr. Chairman. I will
Thank you
do that.
very much. If you would do that, we would be most appreciative. Thank you.
So, Mr. Chairman, to clarify, I can leave the hearing now and proceed to the
Yes, right
embassy.
now you can come back as soon as you get your oath. Thank you.
Thank you, Mr. Chairman.
Thank you. Please proceed, Senator De La Rosa.
Thank you, sir. Thank you. Thank you, Mr. Chairman. So again, going back to Yusek Lloyd Lau, nag-inspect ba ang DOH ng quality nung dineliver ng Parmali sa gobyerno? Na-inspect ba?
Yes, Mr. Chairman. The Farmally submitted documents establishing that the items that delivered are of good quality. PSTBM conducted a quantitative inspection, whether it is of appropriate amount, and DOH together with PSTBM also inspected the quality. Furthermore, Mr. Chairman, even after the acceptance of the said items, when it was used and delivered already to the hospitals, the hospitals in fact made favorable response to the Secretary of Health and the IATF and NTF that the items that were delivered are very of good quality. Kaya doon kami natuwa kasi the users themselves were saying, ang ganda. So with all the testings and all the inspections, we complied with it. Furthermore, the response of the end users, not only DOH, but the doctors and the nurses responded positively. And if you would like to look at the data, upon arrival of these PPE sets, when they were distributed to the hospitals, the death rate of the health workers and the doctors significantly dropped. April 2 pa lang, 17 na ata namatay na doktor. But when we started deploying these items, not me, when IATF and NTF started deploying these items, we have seen na wala na tayong clamor na namamatay yung mga doctors, namamatay ang nurses, because this time they were confident that they are protected and they continued serving as frontliners. And we on the back end was able to do our job, to deliver it to them. IATF was able to bring it to their hospitals. And with this chain of work by all coordination of all government agencies led to the success of everything. It all started even when Congress passed the law allocating budget. So it's a chain. Lahat tayo nagtulong-tulong. And we are proud of it to be at least a part of it, Mr. Chair.
Thank you, Mr. Yusek Lloyd Lau. So babalikan ko lahat, klaruhin ko sa iyo, yung sinabi mo kanina, nag-deliver si Parmali, na-inspect at pumasa ang dineliver ni Parmali na PPE sa gobyerno. Tapos nung kumpleto na ang dineliver, doon pa lang nabayaran si Parmali ng gobyerno. Am I correct?
Yes, we only paid in full after full delivery, Mr. Chair.
Thank you, Yusek Lau. Personal questions?
Hindi na po ako
Ilang
Yusek.
taon ka na bang nagtatrabaho under President Duterte?
In the government, Mr. Chairman, I started working on June 2016 until
2016?
Yes, in the national government. Sa local government, I was a consultant only for violence against women, child abuse, and trafficking in persons. Where my job mainly was to prosecute abusers of women. My job was to prosecute child abusers. My job was to prosecute and represent. My job was also to represent traffic women and children, and we file cases against traffickers. So that started that job in 2005 when I became a lawyer. That became part of my advocacy together with the city government of Davao.
Okay.
Thank you.
Yung pagtanggap nyo sa Parmali, ganito, nakatanggap ka ba ng tawag galing kay Secretary Bungo na paboran mo itong Parmali dahil ito ay konektado kay Michael Yang na kilalang kaibigan ni President Duterte? Nakatanggap ka ba ng tawag or instruction coming from Senator Bungo na paboran ninyo itong Parmali?
No, Mr. Chair. I would like to explain to the public para malaman nila. Parmali did not supply PPEs or these items to PSDPN outright. Kasi walang supply nun. Kasi kung may tumawag, sila dapat ang supplier, di ba? Ang nangyari nun, wala talaga. Kahit sino wala. So we have to reach out to China using diplomatic channels. And China responded. Kaya ang nag-supply sa atin, mga foreign companies first. Then later on, saka pumasok si Parmali. So it's a series of events. Nobody called.
Kaya lang. For the record lang, ha? May binigyan ka ba ng instruction ni Senator Bongo na paboran ang Parmali?
No, sir. No, sir.
Wala. For the
It's
record,
not
ha?
ATF and NTF.
Oh, another question. Meron bang nakinabang dito sa transaction with Parmali? Meron bang nakatanggap ng kickback, nakatanggap ng commission?
No, sir. No, sir.
Ikaw, tanongin kita, na may natanggap ka ba? Wala.
Wala po, sir. These are all legitimate transactions. Multiple companies po sila lahat. Series of transactions yan. And mabilisan yan.
Kaya tinanong ko ito sa'yo, Mr. Chairman, tinanong ko ito dahil in fairness kay President Duterte, I've known him for 35 years. At alam ko, kapag isang tao niya ma-involve sa corruption, hindi yan tatagal. Tanggal ka agad yan. I've seen very close friends when he was still a prosecutor na bigla siyang naging OIC mayor after People's Revolution. Then naging mayor siya for 3 terms. Afterwards, naging congressman siya. Afterwards, bumalik siya sa pagka-mayor. Another 3 terms. Afterwards, naging vice mayor siya kay Inday Sara. Then after that, bumalik naman siya pagka-mayor. Hanggang naging presidente siya. I have seen a lot of good friends, very close friends of President Duterte na kasama niya sa trabaho. Pero since itong mga tao ay na-involved sa corruption, gandahan ito nalalagas. And also in fairness to Senator Bongo, kahit sabihin natin na siya ay isang dakilang alalay lang, kahit senador na siya ngayon, in fairness sa kanya, hindi yan tatagal sa tagiliran ng ating Pangulo kung yan ay gumagawa ng kalukuhan. Dahil alam ko si President Duterte, hindi talaga yan papayag na magkakaroon ng korupsyon. Kaya kayo, Yusik Lau, I am advising you, bago ka pa lang dyan sa serbisyo dito sa ating Pangulo, ayusin yung trabaho ninyo dahil lahat ng pagkakamali ninyo, hindi man kayo na-involve ng corruption, kung ma-involve kayo ng incompetence, ang latay niyan, ang tama dyan kay Pangulo pa rin. Kaya ayusin yung trabaho ninyo. Hindi ako nagsasabi bilang isang kakampi ng Pangulo. Ako yung nagsasabi dahil nga experience ko ito, nakita ko kung gaano siya magtrabaho, gaano siya kagalit sa corruption. Kaya ayusin yung trabaho niyo dahil hindi ka talaga tatagal dyan kapag meron kang ginawang kalukuhan. Yun lang po, Mr. Chairman. Maraming salamat for giving me this opportunity. Thank you, Secretary Doke and Yusik Lau for answering my questions. Mr. Chairman, salamat Mr. Chairman. Thank you. Akala ko isnabin mo ako. Salamat.
Mr. Chairman.
Mr. Chairman, I'd like to address this to my good friend Senator Bato. How can I snub you when you are so sincere? All right.
Thank you, sir. Thank you, sir. Thank you, sir.
Thank you. Let me.
I will not. I cannot forget your lessons taught to me that it doesn't mean that I disagree with you. I don't like you.
Of course.
Yun ang hindi ko makakalimutan talaga, sir. Thank you for that lesson. Salamat, Mr.
Very
Chairman.
much. Thank you very much. I know your position. Thank you very much. Senator Soto is recognized with the permission of Senator Villanueva because
Very briefly.
go ahead, please.
Thank you. Just
Time.
while Attorney Lau is still there. Attorney Lau.
Yes, Mr. Chairman.
Yes. Ilang PPE binili nyo?
Ang total PPEs, the total PPE sets quantity is 2,517,000. The surgical face mask is
Hindi,
141.
PPE lang tinatanong ko dahil yun ang tinatanong ni Senator De La Rosa.
PPE
Ilang
sets is
PPE binili nyo? Ha?
2,517,000 pieces.
2 million
517,000.
517,000 pieces. Magkano?
4 billion. No. Sorry. I apologize. The total PPE sets quantity is 12,158,355. The total value is 14,819,762,000 pesos.
So hindi nga pwedeng compare ang apples and oranges. Ano? Tama ba? Ilan billion?
12
14.8 billion. 12 million pieces. Hindi pwedeng i-compare sa 15 million. Ano?
But
Anyway.
we bought it in tranches, Mr. Chair.
Anyway, ano?
We bought it in tranches.
Okay.
Several bits.
Yeah. All right. Anyway, thank you for that. Let me just, Mr. Chairman, ask Chairman Aguinaldo for clarification dito sa statement niya sa hearing sa House of Representatives last September 3. Chairman Mike, nandiyan ka ba? Yun.
Nandito po, sir,
Yeah.
Mr.
You
Chair.
said something to the effect that there's already been, of course, an audit for the year and quote kita mismo, and the main observation po na naging ng resident auditor was that there's really a problem with inventory management. Kasi po ang nangyari, a lot of these supplies were procured in April 2020 at the certain price range, kaya lang noong by September of 2020, medyo nagbagsak ang presyo. So the problem was they still have a lot of inventories in their hospitals, in their warehouse na hindi nila na-dispose. Now, meanwhile, itong mga regional offices, regional hospitals ng DOH, ayaw nang kumuha sa PSDBM kasi sabi nila, napakamahal ng sa inyo. We can just go across the street and buy 3 to 4 times less. So yun po yung nagiging problema. It was an inventory management issue. End of quote. Now, gusto kong malinawan, Chairman Aguinaldo, what do you mean by this? Bumibili yung regional hospital sa PSDBM?
Opo, kasi ang nangyari, naging common use supply, Mr. Chairman, naging common use supply kasi yung classification ng mga PPEs, mga face masks, and the like. And so, yung requirement kasi is, because nag-fund transfer nga ang DOH, so yung mga supplies nitong DOH offices and hospitals, kukunin nila from PSDBM. So, in effect, parang...
Binibili nila?
Parang ganon nga po.
Ha? Ba't bibili nila yung binili ng PSDBM tapos ibebenta sa regional hospitals?
Hindi po.
Mga hospital, bakit? Ano? That was your statement eh. Kaya ako gusto ko linawin. Sabi ninyo, itong mga regional offices, regional hospitals ng DOH, ayaw nang kumuha sa PSDBM kasi sabi nila, napakamahal ng sa inyo. We can just go across the street and buy 3 to 4 times less. So I'm wondering, how can a PSDBM that was given by DOH their money to procure, ay ibebenta sa mga regional hospitals at sa DOH hospitals.
I think Mr. Chairman, I think Secretary Galvez would like to comment on that, on the procedure. Opo.
Sir, Mr. Chair, if I allowed to answer.
Yes, go ahead.
Sir, Mr. President, actually sir yung binabay ng PSDBM na yung ginawa ng APR ng DOH. Separate po 'yun sa mga binebenta kasi yun po naka-allocate na po 'yun sa 699. So ibig sabihin yung binenta na pinrocure po ng PSDBM, diretso po dinadala po 'yun sa warehouse ng AP Logcom kasi dalawa po yung warehouse natin doon na yun ang kinakargahan ng mga procurement natin directly from a PSDBM. And then also, iba po yun. Ibig sabihin yung common use po na sinasabi po ni Coa Aguinaldo, separate items. So yung procurement po namin, separate din po yun kasi ang po niyan, immediately dinadala po namin kaagad doon sa hindi po binibenta yan. Libre po yan sa mga regional hospitals at private hospitals po, sir.
Is that correct, Commissioner, Chairman Aguinaldo? Dahil hindi yun ang sinasabi mo sa hearing sa House. Ang sabi mo, hindi na sila kumukuha dahil napakamahal sa PSDBM.
Tama po si
bumibili sila.
Secretary. Tama po si Secretary, there are two types kasi. Yun nga, merong yung pre-procure nila na diretso na sa Logcom and then it's given free. And then meron din po yung pre-procure through PSDBM na yun nga, they have to in effect purchase from PSDBM. So magkaiba po yun.
Bakit ang regional hospitals at saka DOH, whatever kung ano man yun, bakit sila kailangan bumili sa PSDBM? Pera ng DOH yung pinambili nila.
Hindi po ata lahat yun ng 42 billion po. In fact, hindi pa ata gamit yung buong 42 billion. I think only 31 billion has been used so far. But meron rin silang pre-procure and then pwedeng kunin doon as common use supplies po.
Oo nga, bakit sila sa DBM bibili?
As PSDBM kasi po yung nagpro-procure ng mga as common use supplies po.
Correct. Kung procure sila, ibibigay nila dapat ng libre sa DOH at sa mga regional hospitals. Bakit kailangan bumili sa kanila? Or kasabihin nyo pa through them, why? 42 billion nga yung nilipat eh. Sabi nyo nga, hindi pa nga nag-alimit yung 42 billion. Medyo nahihirapan akong intindihin eh. Dahil hindi dapat bumibili ang DOH at saka regional hospitals sa PSDBM. Hindi naman tindero yun eh.
Mr. Chairman, if I may, just to provide clarity, yung pong PSDBM, meron silang tindahan eh. Meron silang sariling mga supplies na binebenta. Ang magandang tanong dyan is yung mga regional DOH, kung meron nga silang pinamili, kailan ito? At ano itong mga bilang ng kanilang mga pinamili? Para maging malinaw, ibig ko rin pong respectfully requesting the chairman to recognize former USEC Lloyd Lau para siya po nakakaintindi doon sa tindahan ng PSDBM na nagbebenta sila ng kanilang mga common use supplies na hiwalay doon po sa binili naman ng PSDBM para sa DOH. Thank you, Mr. Chairman.
Chairman Aguinaldo, do you accept that?
Opo, kasi
mayroong tindahan ng PSDBM?
actually, ganun po yung nangyayari. For common use supplies, ang nangyayari is there's a certain float na binibigay sa PSDBM and then doon china-charge yung mga purchases. Kunwari, mga ballpens, mga regular supplies. Ganun po yung ginagawa.
Staplers, paper clips, ballpens. Iba ito eh. Ito sa pandemic ito eh. Ang pera galing sa DOH eh. Hindi yan yung mga paperclip at ballpen na binibili ng Senado sa kanila eh. na mga ibang departamento eh. Iba't ibang departamento eh. Kaya hindi ko maintindihan bakit kailangan ang regional hospitals, DOH, bibili sa PSDBM ng mga hindi hospital, mga equipment eh. Supplies eh. Para sa pandemic eh. Yun ang hindi ko maintindihan. At ikaw ang nagsabi nito. Hindi ko naman mapapansin ito kung hindi mo sinabi ito sa hearing sa House of Representatives eh.
Opo, yun po Mr. Chairman, those are the findings ng audit team on the ground. So, yun po yung nakita nila that gaya ng sinabi po ni Secretary Galvez, there was the procurement nung DOH, part of the 42B, na yun nga was being distributed for free. Pero meron rin pong pinacure ang PSDBM at yun ang china-charge nga dun sa float ng mga regional offices, no? And yun yung parang nag-hesitate daw sila kasi nga ang laki na ng price difference dating nung September, no? Nung una hindi naman po ganon. But come September, medyo malaking price difference. So they were also being cautious with yung kanilang finances, no? Kasi nga mas mura nila makakuha sa labas. So yun po yung naging observation. Oo.
Sabi mo nga, 3 to 4 times less, tatawid lang sila ng kalsada. That was your statement eh. No? Anyway, siguro, kasama sa mga finding ng COA yan. Kaya gano'n, kaya may mga findings, kaya may mga flagging, ano?
Permission of the Senate President, may I follow your thoughts? Just one question lang.
Sige po, Mr. Chairman.
Chairman Aguinaldo, hindi ba na-double book tayo doon? Namili na nga tayo ng mahal, hindi pa naibenta, di lugi talaga ang gobyerno, doble lugi.
Well, because nga the inventory medyo malaki at hindi siguro na dispose kagad, by the time that the prices had already gone down.
And that is what we call in law, sir, isn't it? Lack of foresight, lack of skill?
Partly po, kasi I think one thing we have to consider also dahil siguro pandemya rin. And I guess maybe from the position of those deciding the volume, takot rin naman sila baka mamaya later on kulang yung volume, masisisi naman sila. So it could be that, but yun yung naging observation po. There was a lot of stocks. They're saying na baka kulang yung push to actually distribute this or at least get rid of it. Inaabutan na nung time na medyo bumagsak na yung mga presyo. So there was a hesitance.
But the other side of the coin, and this is my last comment, the other side of the coin is that it is carte blanche trying that they could use to take advantage of the situation. Mahal, kaya marami namin binili. Ang nakakapagtaka, isa lang ang nakinabang ng todo-todo. Actually, hindi lang isa, dalawa o tatlo na nakinabang na napakalaki na binili at napakalaking kapangyarihan na naibigay kay Yusek Lau na nagbebenta siya. Tapos ngayon, nakabitin tayo ngayon. Ang daming inventaryo, hindi natin may benta. Pinipilit yung mga local government na bumili, ayaw na lang bumili dahil tatawid lang sa kalye, nandun na sila. With the permission of Senator Soto, I think Senator Lacson would like to comment.
I think we're missing something here, Mr. President, Mr. Chairman. Ang confusion arises from, nagkaroon ng GPPB resolution. I think this was March 8. Reclassifying PPEs, surgical masks, and other items as common use supplies. Ang tinatanong ni Senate President Soto, okay, nanggaling sa 42 billion na tinransfer ng DOH sa PSDBM. So pera ng DOH. Ngayon, the same items that have been reclassified as common use, yun na ibinebenta pabalik sa DOH sa mga regional hospitals, which is under the DOH, I suppose, kasi district hospitals. Kasi ang na-devolve lang naman sa mga local government units, yung function yung pondo na iwan sa central office. If I may say that, So ang confusion, and this has to be clarified, parehong pera pag-uusapan natin, nag-reclassify lang ng supplies and equipment from non-common use supplies to common use supplies by virtue of the GPPB resolution. I think that was issued in March 8. So, yun lang gusto natin clarify kasi confusing, Mr. Chairman.
Well, who will answer that? Would that be Yusek Lau, sir?
Perhaps, yes.
Yusek Lau, will you answer?
Mr. Chairman, if I may. Mr. Chairman.
Sino yan? Si ano?
Who are you? Mr. Wayan.
Mr. Chairman, PS kasi has two types of funds. Revolving fund, which we use on our own, which we use to buy common use supplies and equipment. Now, in the case of DOH, they transferred funds specifically for their own need. So every time we receive a request from DOH, we bought it for them.
Mm.
The items that we bought using our own funds, that is what we are selling to the regional, to various agencies. That is the clarification, Mr. Chairman.
Various agencies. Ito hindi various agency ito. DOH Hospital. Regional hospitals. Ito pera
Mr.
nila yun.
Mr. Chairman, we bought surgical masks considered as PS tax. One of which is the contract of EMS. At that time, it was priced at 1350. Due to the sudden price drop in the market, the agencies found it too expensive to buy from our own regional depots. That is why the deliveries of EMS were put on hold sometime in November, if I'm not mistaken. And when
Mm.
and when EMS participated in a public bidding last December, they submitted an offer at 2.35. That is why we invoke the clause in the contract with EMS, the right to match, considering that they participated in the December bidding offering surgical masks at 2.35. The original contract was lowered down from 1350 to 2.35. Had it not been the case, Mr. Chairman, we would have an inventory of surgical masks at the price of 1350. That is not what agencies would be buying from us, considering the price drop that happened sometime in November and up to December of last year.
Mr. President, Mr. Chairman, we leave it to the wisdom of the Commission on Audit, no, to decipher what what is necessary at this point. No? But perhaps this could be one of the points of your Blue Ribbon Committee for for a piece of legislation na dapat ayusin natin to. Aba, tayo rin may tindero.
Yes, Mr. President. With all due respect, sir. Let me just ask Mr. Wayan, because lumalabas ang nasisisi pa ngayon yung nagbid ng mababa. Yung nagbigay ng mababa, pinakamababa sa lahat, sila pa may kasalanan. Tataka kayo eh, bumili kayo, tapos kaya bababa namin, tapos hindi niyo mabenta. Eh, ang totoo niyan, namili sila ng marami, masiba sila, kala nila, maloloko nila ang tao na bumili sila ng marami allegedly to protect the people. Eh nangyari, nasayang yung pera ng tao dahil ang dami-dami nilang binili, tapos ngayon ipipilit nila doon sa mga local hospitals, ang DOH, na bilhin yung kanilang produkto. Kaya nga sila sabi ko, double book eh. Doble-doble ang tama. So, sinasabi ko lang po, wag naman natin susihin yung mga ganyan, mga tao na nakipagsapalaran, tapos sisisihin nyo pa. Yan ba sinasabi mo, Attorney Wyatt? Klaseng reasoning yan. Kayo ang namili from the very beginning. At ang nakakapagtaka, bakit ibinigay nyo lahat doon sa mga Chinese suppliers like Parmalee, Wayan, pakita natin, ilan yung mga binili nyo ng billion-billion. Ayan, no? Hindi yan, yung isa, yung kanina, yung marami. Ayan,
Pati
Sa
face shield.
Parmalee.
Yung face shield ba, binili ninyo rin? Bumili rin kayo ng face shield?
That is correct, Mr. Chairman.
Oh, kaya pala yung pinipilit yung paggamit sa amin kahit sa buong mundo tayo lang gumagamit eh. Ang dami nyo kasing binili.
Yan ang gusto kong tanongin, sir. Wala naman sinasabing WHO na bumili ng face shield. Wala naman at gumamit ng face shield. Sapagkat ang face shield talaga, ginagamit ng mga surgeons sa ospital dahil pag natalsi ka ng dugo, ayaw nila mangyari yan. Pero ilagay na natin, bibigay natin doon sa mga nasa COVID area. Nakalagay yung goggles sila. Usually goggles ang ginagamit, pero namili na kayo ng face shield. Hindi ganun karami ang bibili nyo. Pero binili nyo yung face shield na napakamahal. 120 pesos. Can you imagine? 127 pa yung sa Parmalee. Pero pag tinignan nyo yung mga matataas nga, Husaw, yung Parmalee, 8.7 billion. Pagkatapos ang sumunod ay yung Suhaw, 1.898 billion. Nakakapagtaka. Pharmawell, 1.7 billion. Hapid Erasmus, 892 million biocide medical instruments, 779 million. I don't have to cite that. Daan-daan milyon, ang laki ng kapangyarihan ng PSDBM. Tapos kayo, meron pa kayong ganang sisihing yung nakipagsapalaran ng Pilipinas, samantalang lahat ang Chinese suppliers. Hindi naman ako xenophobic, Mr. President, pero sinasabi, xenophobic rin ako, dahil nakalagay the facts cannot be denied. Karamihan yan, Chinese companies, hindi natin napagbigyan, at nakalagay sa batas natin, sa Bayanihan 2, na dapat preference should be given to local suppliers. Ayan po, babasahin ko sa inyo. Attorney Wayan, nakalagay, policy ng pamahalaan to give preference sa ating domestic bidders. Ayon sa IRR, number RA 9184, the procuring entity shall give preference to materials and supplies produced, made, and manufactured in the Philippines. Ibig sabihin, yung mga katulad nitong mga naglakas ng loob, dapat bigyan sila. Pero huwag nyo naman isisi. Kayo may kasalanan. Mali ang forecast nyo. Why don't you accept that? Nagkamali kayo sa forecast. In other words, panalo kayo sa lamig, panalo pa rin kayo sa talo. Di ba? Di ba, Attorney Wyatt?
Mr. Chair.
Mr. Chairman, I could not comment on that, on how the
Why can you not comment on that?
I was not yet connected at PSDBN at that
Yun
time.
ang problema. Huwag ka magko-comment doon sa hindi mo na hinawakan because lalabas yung ginawa nila. Dapat sila ang mag-comment. Yes, Attorney Senator Pangilinan.
A very quick interjection, Mr. Chairman. The GPPB resolution dated March 9, 2020, that listed the items submitted by the DOH for inclusion in the list of common use supplies and equipment, does not include face shields.
In fact, to follow your point, Senator Pangilinan, hindi ba para silang goma nung una, magpe-face shield tayo. Tapos, inatras. Tapos bumalik ka naman sa face shields. Ni-require pa.
And
naman sa
hindi
buong
po,
mundo, ilang bansa lang, halos walang bansa na nagpe-face shield, tayo lang.
and just to add to the point raised by the Senate President, hindi ho kasama doon sa common use. Bakit binili?
Correct.
Bakit binili yung hindi kasama? Tapos masks lang ba ang binili o pati face shield ba binebenta? Pero bakit biglang merong face shield na hindi naman required at wala doon sa common use? Sinong supplier ang malakas na naisingit itong face shield bilang bibili ng bilyon na wala naman doon sa common use at hindi rin required ng WHO?
At galing pa ang utos sa pinakamataas.
Mr. Chair.
IATF has no... I'm sorry, I want to listen to the people who bought it. Were you the one who bought it, sir?
Sir, actually, sir, that's an ITF resolution that we will require the face shield. It is
All
an
right.
ITF.
May answer then.
That's why it was included in our procurement. We include that in our procurement because it is an ITF resolution that face shield is included in our minimum health standard.
Let me ask you a question then, Secretary Galvez. You did it on your own?
No, sir. That is a recommendation of the ETSPA Act, our medical expert. It was decided by unanimously by the ITF and the NTF.
Again, with the permission of Senator President Soto, who might these people be? Sino yung mga yan?
Sir, maybe Secretary Duque can answer that.
Mr. Chairman, susugan ko lang po yung sinabi ni Secretary Galvez. Yung proseso po kasi, yung nag-recommend strongly as to the use of the face shield as an extra layer of protection on top of the mask, no? Social distancing and ventilation and frequent washing of the hands. Yung HPA Act, this is the Health Professionals Alliance Against COVID. Isa po yan sa mga recommending body of experts. Kasama din po yung Technical Advisory Group of Experts. We will
Please answer my question.
Yes, sir.
My question is, who are these people? Who are these sacred cows or these, whatever you want to call them? Sino yung mga yan? They're faceless to us.
Yes, the experts are the following. The Technical Advisory Group of Experts consists of Dr. Edsel Salvania, Dr. Isa Alejandria, Dr. Ana Marie Ong Lim, And then, of course, the group representing the HPAAC, we have Dr. Antonio Dans and Inday Dans and other experts. In fact, ang face shield is also included in the WHO standards for healthcare workers. So kasama po ito. For mga healthcare workers, kasama po ang face shield.
For healthcare workers, Mr. Chairman, hindi
Correct.
ano sa naglalakad sa kalsada o sa mga pumapasok sa kung saan mga mall o restaurant na ano, because you should have Secretary Duque, you should have consulted also aside from your consultants na yan or experts, you should have consulted the engineers like a civil engineer is specializing in wind dynamics is saying that basically what the face shield is doing is you're becoming a vacuum cleaner. Ano? When there's COVID in the air, you would be sweeping all the particles in the air based on the configuration of the face shield. Ay, hindi pa pwedeng ano eh. Bakit sa buong mundo tayo lang? Ano? In China and in other places, it's or face shield or mask. But if you have a mask, you don't need a face shield. Pagkatapos, hindi nyo kami masisisi kasi una, tayo lang gumagawa. Isa. Pangalawa, sang tambak yung binili nyo. Oh, ba't hindi kami mag-iisip? Kaya nyo pinipilit para magamit dahil napakadami yung binili. Hindi ba? Ganun na magiging mentality ng mga kababayan natin. Ipagpatawad nyo, pero ganun ang nagiging nangyari. Anyway, Mr. Chairman, thank you.
Mr. Chairman, if I may, Mr. Chairman.
Secretary Duque.
Yes,
In
sir.
fact, I remember hearing the Senate President way back when he said, sino kaya ang magaling na lalaki na nag-recommend itong face shield na ito? I remember that in our thread, no? And let me just first housekeeping muna. Let me call all these so-called experts. Have you said already to us na tatawagin namin niya ngayon?
We will provide you the list, Mr. Chairman. Plus,
You already mentioned some. We will call them already because
yeah, certainly.
Sasabihin nyo lang, basta ito mga experts ito. Let me cite to you, sinabi ni Senate President Soto ng araw, sino yung genius na yan? Pero let me cite to you what the CDC and the World Health Organization says. Can you show us the World Health Organization and the CDC, please? World Health Organization on face shields. Face shields are designed to provide protection from splashes of biological fluid, tumatalsik na dugo. And that in the context of COVID-19, face shields are used by healthcare workers in hospitals, sa hospital lang, together with other personal protective equipment as they treat patients. Current laboratory testing standards only assess face shields for their ability to provide eye protection from chemical splashes. However, the WHO specifies that face shields can be used as an eye protection against respiratory droplets, can be in conjunction with face mask. It has the potential, but it did not recommend using it. The U.S. Center for Disease Control and Prevention, CDC, face shields are not as effective as protecting you or the people around you from respiratory droplets. It added that it cannot be used as a substitute for face masks. Both the WHO and the CDC do not have recommendations on making wearing face shields a policy. Pero pinilit niyo yan. Limpak-limpak ng face shields ang in-order nyo. Ang laking bilyon ang inabot yung mga face shields yan. Daang milyon. So the long and the story, or short of the story, is PSDBM and all you folks out there, hindi ko kayo nilalat, is a kingdom unto itself. May sarili kong kaharian, answerable only to the President. Given what we have seen, tama si Senate President Soto, the law has to be changed, either abolishing it or repairing it if it still can be salvaged. That's just the point of this committee. Gusto naman namin proteksyonan ng mamamayan na yung mga perang binayad natin sa mga buwis, dapat hindi masasayang. Di ba kung naiwan yung pera dyan eh. Hindi naman naiwan yung pera eh. Nilabas na siguro yung perang yan eh. Yun ang problema. So,
just a quick point on the face shield,
yes,
Mr. Chair.
Pangilinan.
Yung IATF resolution mandating face shields, when was that acted upon? When was that passed? kailan pinasa yung
I believe
IA?
it was December 2020.
December 2020.
Right.
Pero binili yung face shields ng first quarter ng 2020, hindi ba?
Yes, di ba parang rubber band yan, urong, sulong.
Oh, so in other words, the mandate,
Nakita malaki ang kikitain. Malaigo,
the
hindi naman ako nagiging
mandate-
kondako.
Reiteration.
the mandate was required after the billions or a billion worth of face shields were bought.
Mr. Chairman, yung mga face shields na binili, kasama po part of the PPEs. Yung IATF resolution, I'm having my staff check on this, Mr. Chairman. Meron po kasi noong December 14, 2020, IATF through resolution number 88 reiterated the use of face shields for all persons. So this is an IATF policy, Mr. Chairman. And we again reiterate that what we procured are for healthcare workers. Yun lang po, Mr. Chairman.
Well, I just want to add here, that same order was retracted by PRRD on June 2021.
Mr. Chairman, there was, you are right, there was a retraction by the President, but eventually, when the President had invited the technical advisory group of experts, the PAC experts said that for outdoors, it is not going to be mandatory. It's going to be permissible. But the President, this is during his Talk to the People program, had instructed that no, because of the variants that are happening, he wanted to make sure that there will be an extra layer of protection, and so he decided that the face shield ought to be used even outdoors. Thank you, Mr. Chairman.
Mr. Chairman, I cannot accept that reasoning because the night that the President said, that wala yan, wala talagang pakinabang yan, alisin nyo na yan. Hindi? And I will tell DOH, he said so, o the following day. Di ba? Wala pang 48 hours. Mr. President, sinasabi ngayon, bumaliktad ng Presidente. After Secretary Duque said na after he consulted with these four, kung mga H-TAC o sino man sila, kailangan 48 hours nga yung swab para kausapin ng Presidente. Saan nila nakasausap? Nagpunta kagad sila sa Presidente the following day?
Nag-Zoom po, Mr. Chairman, nag-Zoom meeting po. Zoom meeting po yung meeting, and that's documented, Mr. Chairman. We will produce the transcript of the same, Mr. President.
Kaya
Mr.
nga, they
Chairman.
started convincing the President again. Dapat kami nakausap ni Presidente, hindi kayo. Yun ang tama dun eh.
Well,
Yes.
I rest my case, Mr. President.
Can I have?
Kung bakit hindi nire-require ng WHO at saka ng CDC tapos biglang i-require natin. Senator De Leon is recognized.
Yes. Thank you. Just a few questions on the secretary. Is it true that you purchased from PSDBM the face shields at 124 pesos on April 29, 2020?
Mr. Chairman, can I defer to Yusek Lloyd Lau, who knows the exact pricing point? Thank you, Mr. Chairman.
With all due respect, can we request the secretary to remove his mask when he answers our questions? We can hardly hear him. So I go back to my question. Is it true that DOH bought from PSDBM face masks at 124 pesos per piece on April 29, 2020?
Did you say face mask? Can I just clarify?
I'm sorry, face shields. Maybe I forgot. Face shields. Yes, I have the, yeah.
I'm having it verified, Mr. Chairman. Perhaps PSDBM might be able to answer it more authoritatively. But I'm still having it checked, Mr. Chairman. Can you give me just a little more time? Thank you.
Yes, that's why I want this clarified, because from what I see as records, you purchased from from PSDBM face shields at 124. Maybe and then are these the same face shields that PSDBM purchased from Blue Cross at 120 pesos?
That's correct.
Mr. Chairman, with all due respect, may I just ask the USEC Carol Taino to give her rejoinder to the question. Thank you, Mr. Chairman. USEC Carol Taino.
Blue Shield, Blue Cross.
I could hardly anyway. What's the response? Is it is this true or not? Did you purchase from a PSDBM face shields at 124 pesos on April 29, 2020?
Andiyan na po si USEC Carol Taino, Mr. Chairman, the head of the Procurement Supply Chain Management Office.
May I request that whoever is the staff of the good secretary relay the answer to the secretary and for the secretary to answer this. Please don't pass me off to your director or whomsoever. Yes, you can consult your director as to whether the statement I am making is correct or not. But please answer respond to the question.
Good afternoon, Mr. Chairman, Your Honors. Yes, we confirm that we have procured face shield from the PSDVM.
For 124 pesos, that's there is a purchase request. Is that correct?
Yes, Your Honor, Mr. Chair.
All right. Is this same face shields, was this the same face shields purchased from Blue Cross at 120 pesos on on April 22, 1 week before it was purchased by DOH?
The source of the procurement from the face shield that we do not know, sir.
Yeah, but you purchased it from PSDBM.
Yes.
Is
Through
that
the
correct?
virtual store. Yes, sir. Opo.
And the inventory at that time came from from Blue Cross, which the PSDBM purchased at 120. Okay, now I'll go to my question now. Mr. Secretary, when you moved 42 billion to PSDBM, was it to replenish or was it to purchase the inventory of face shields, face masks, etc.?
Mr. Chairman, my documents will show that when we downloaded through the agency procurement request or the APRs, this started on March 26, spanning through several months until December 4, 2020. And the
Please, Secretary Duque, answer my question. When you moved 42 billion, was it to replenish or to build up the inventory of PSDBM for the supplies?
No, Mr. Chairman, definitely, Mr. Chairman. So yung PPEs po ang amin.
In what concept did you transfer this? There, you can only transfer it on the role of the PSDBM, and I hope the chairman of the COA listens. When you move 42 billion, it's either you move this to DBM in the concept of a procurement entity directing PSDBM to purchase it for you, or you transfer this money to build up the inventory for common use supplies. Hindi po ba? Dalawa lang yun eh.
The former is correct, Mr. Chairman.
Okay. If I am correct, then in what concept did you move these funds? Did you move these funds to PSDBM as the agent of DOH, or do you move it to PSDBM so that they will have an inventory of these so-called common use supplies and equipments, so that when the government agencies, government hospitals would need this, they do not have to go through bidding. There, in other words, the PSDBM became a virtual store where these government agencies simply place their purchase orders. So which one? I'm interested, Mr. Duque.
Yeah, the first one is correct, Mr. Chairman. We had to download through the APR for them to purchase the needs of our healthcare workers.
So okay, to purchase. When you requested them to purchase, did you request them to purchase in your behalf? Yes or no?
It was an APR that I signed. In fact, 9 of 14 APRs were signed by Yusek Caro Taino, and I did sign 5.
I'm sorry, Mr. Duque. We're running out of time. Just answer my question. When you move 42 billion to PSDBM, did you move it in order that they can purchase for you the medical supplies and equipment which are now classified as common use, or did you transfer the 42 billion so that PSDBM can build an inventory from where the public hospitals can get the supplies? Which one?
The first one, Mr. Chairman, the procurement of these supplies as common use supplies and equipment on our behalf, Mr. Chairman.
So so PSDBM was your agent at that instance when you moved. Is that correct?
I cannot use the word agent.
What were they?
Well, they were the procuring entity of the national government based
They were
on
the procuring entity of the DOH, right? They were the procuring entity of the DOH, right or wrong?
That is correct.
What I'm asking is, in what capacity did PSDBM receive this? Did they receive this 42 billion as the agent of DOH, or they received this in order to build up their inventory of common use supplies? And Mr. Duque, Mr. Secretary, you admitted that you purchased face shields from PSDBM. Which face shields were purchased from Blue Cross and was funded by the 42 billion, which was transferred to by your authority, moved over to PSDBM.
I have to check that, Mr. Chairman. I will have to confer with the PSDBM Yusek Taino.
Mr. Secretary, it is most disappointing that you moved 42 billion to another agency and you cannot even remember what was the nature of the transfer. I mean, that's not 42 pesos, that's not 42,000, that's not 42 million, that's 42 billion. And you cannot even answer me now what was the nature of the authorization to PSDBM. I'm asking a very simple question. When you ask PSDBM to purchase this, were they purchasing this so-called common use supplies as your representative and agent and in your behalf, or did you pass on to them the 42 billion so that they can have an inventory of medical supplies worth 42 billion? Very simple question.
Mr. Chairman, I stick to my earlier rejoinder that we procured this as part of the common use supplies and equipment.
You
respond
purchase
to
this
the,
as common
pandemic,
use supplies and, I'm sorry?
the common use supplies and equipment, and that is the concept, that is the basis for our downloading through the agency procurement request
No.
as
After
stipulated
procurement,
in the
after the
GPPB.
procurement is made, who now owns the supplies? PSDBM or DOH?
The DOH, Mr. Chairman.
DOH. So why did you purchase face shields from PSDBM if DOH is the owner? Why was there a suggested retail price? And the suggested retail price was already so high that the agencies did not want to buy it anymore.
Mr. Chairman, with the permission of Senator Drilon.
Yes, sir.
Yes. To summarize yung point na nire-raise si Senator Drilon, di ba double payment yan? Nag-advance ka, tinransfer mo yung pera, tapos bibili ka uli, sarili mong pera ginamit.
Yeah.
It's a case of double payment.
Paliwanag po yan, sir. And not only that, may commission na 4%.
Nagamit per service fee.
So, talagang hindi ko maintindihan. Maliwanag naman eh. Tinatanong na namin simple lang. Ha? Ito po ba nung binigay niyong 42 billion, ang sabi nga ni Senator Recto, pabili. Ha? Pabili. Ibig sabihin, kung bumili ang PSDBM for and in behalf of DOH, the supplies are properties of DOH, logically. Now, why is it that you purchase your own supplies? Bakit po binili nyo yung inyong sariling supply? At mas mataas pa by 4 pesos in this particular instance? Wala po tayong, hindi natin paliwanag ito siguro, ano?
If I may, the purchase of the DOH, these are loose face shields and surgical mask pieces. Hindi po siya kasama doon. Kasi pinamigay din namin ito, hindi po siya kasama doon sa PPE sets. So these are separate items. The PPE sets will be accounted for, can be accounted for with the document trail, with the paper trails, Mr. Chairman.
It's not a question of accounting. For the last 20 minutes, I've been trying to get the correct situation, and I keep on getting turned around. I mean, answers which are not precise. I have a very simple question. When the PSDBM purchased the face shields, did they purchase this in behalf of DOH, or did they purchase this as part of their inventory?
The first one is correct, Mr. Chairman.
What is correct?
They bought it in our behalf, Mr. Chairman, based on the GPPB resolution.
They purchased it in your behalf. So why did you purchase it back from them if they purchased it in your behalf? You are the owner.
No, Mr. Chairman, I'm sorry, but I have no information of the same that we purchased this. Can I just respectfully ask Yusek Carol Taino to please clarify this particular
we have no more time, but anyway, you'll have time to research. Now, the next question is, and this is because this is in relation to the finding of COA. If you said it was purchased in your behalf by PSDBM, didn't the rules of COA, the internal IRR, require a memorandum of agreement? Because these were you were designating PSDBM as your agent, your purchasing agent. You are the principal. The money is never is still the funds would still be with the DOH, and that is why that's why there's a MOA required under the rules, because you entrust to them funds of your department. Now, so you know, please explain this, because under what you're saying now as the nature of the transaction, in effect, these masks, shields, etc., are properties of the DOH because the budget came from the DOH. And by your own declaration, DOH simply asked the SDBM to purchase it for DOH. Now, you purchase it for the DOH, and yet the PSDBM, when they moved back the merchandise or the supplies to DOH, DOH paid 4 pesos more than the 120 pesos na nanggaling din sa DOH budget. Mr. Chairman of the COA, can you clarify us on this?
Yes, Mr. Chairman. Yeah, kasi kung stock in trade din or nasa inventory na po ng PSDBM yan, yun yung sinasabing hindi na kailangan ng MOA kasi you're just getting the items and then i-deduct na lang dun sa float na the amount of money that you already transferred beforehand. Kaya lang dito, it might have been a combination. There might have been some stocks, but then mukha namang there was really a requirement for them to purchase for DOH. Kaya nga nag-fund transfer. And in fact, as clarified by Secretary Galvez, itong mga binili were those that were distributed or being distributed sa DOH regional offices and the like. Kaya nga po we were requiring the auditors were requiring a MOA.
That is why, since they were just purchased, since PSDBM purchased this for and on behalf of the DOH, there should have been a MOA under the rules of the COA.
Yes po.
All right. Yeah, that's all I wanted. And here, there was no MOA sign.
Wala pa po.
Wala pa.
Mr. Chairman,
Isang taon na eh.
Mr. Chairman, if I may just respond very quickly. The PSDBM has been of the position, and they have these documents to say that the legal basis for the procurement by PSDBM of these common use supplies and equipment is supported by the letter of instruction number 755, the GPPB resolution 03-2020, and also PSDBM section 4 of executive order EO 285. But I will just give you the copy of these documents, and that has been reiterated in a document that has been submitted to me by Attorney Paul Gimbarda of the procurement and supply chain. Now, I would like to read out to you the one of the recommendations of COA in their consolidated agency annual report. Nakalagay po dito, management of fund transfers. No? We recommend, this was given to us when the AAR, the CAR, was submitted. No? A, we recommend that the Secretary of Health, A, to direct the heads of the operating units to prepare, amend, and submit the duly signed MOAs and henceforth require MOAs prior to transfer receipt of funds. So, meron po silang recommendation, and I have asked the PSDBM na kailangan may MOA. This is the recommendation of the COA. But the PSDBM, it is invoking that there is no need Because by virtue of the GPPB Resolution 03-2020, they can procure for us these items which have been identified as common use supplies and equipment by virtue of another resolution, Mr. Chairman.
Mr. Secretary, as every lawyer will tell you, in the situation that we see today, or when these purchases were made, from your own assertion, DOH retained the ownership of the budget. Now, you authorized DBM to purchase. You changed the nature of the asset from being cash in the budget to face mask, face shields, etc. So you should still own that asset, which you now distribute to public hospitals, etc. But in this particular case, that same asset of the DOH, which is now in the form of a face shield instead of a cash of 120 pesos, it was sold to you for 124. Hindi ba, doesn't that bother you as a, and then it is sold to you at 124, ginamit ang pera ng DOH para bumili, para pinagtubuan. Ha? Ito talaga tubong lugaw. Talagang pera nyo na, binili, sabi mo, pabili mo ako ng face shield. Oh, sabi ng DBM, ito na yung face shield, bilhin mo sa akin ng 124. In the simplest terms, something is wrong with it. And then they made 4 pesos in this example, and then they make 4 pesos as a profit, and then may commission pa sila using budget and funds allocated by Congress to DOH. I leave there, Mr. Chairman. I think it's almost 4 o'clock. This is something that will be beyond explanation. I don't know how they will explain this. And then, just one more point. PSDBM said there is a suggested retail price. If there is a suggested retail price, that means they are selling their asset and it should be bought at this suggested retail price. If DOH simply put this in the hands of PSDBM as an agent or by agent of the procurement entity, which is DOH, why should there be a suggested retail price? Hindi naman pag-aari ng DBM yun, ng PSDBM. Why is there a suggested retail price? SRP. Huh? And therefore, they're saying the suggested price is this. You buy it at this price. The funds come to us, goes back to us because kami ang nagbenta. But ang pera galing sa DOH. Something, yeah.
Thank you, Mr. Chairman. What I understand is that the budget that was used to buy these common use supplies and equipment is separate from the money utilized to purchase the face shield. These are loose items of face mask and face shield.
What was the budget of PSDBM for 2020? I assure you that they do not have that kind of a money and a budget to be able to purchase 42 billion pesos worth of common use supplies, which are medical equipment. Kaya hindi mo pwede sabihin budget yan ng PSDBM. Yung budget po galing sa DOH. Sabi nyo,
that is correct, Mr. Chairman. That is correct. This is evidenced by our APRs. The documents are with us. These are the agency procurement requests that we downloaded.
Which you purchased, which you gave to PSDBM. This is a purchase agency purchase request. Ang binenta sa inyo, yung binili nyo rin.
Hindi ho, Mr. Chairman. I beg to disagree. But anyway, I will look into this give me a little more time to clarify this, Mr. Chairman, with your permission. Thank you, Mr. Chairman.
Go into it. This must be explained. Because if you cannot explain this, may sabit po kayo. Pag hindi nyo napaliwanag ito.
On the record lang, Mr. Chairman, we
Kung
do not
sinabi nyo ito ay
double
kung
payment.
sinabi nyo na ito ay nilipat lamang para baka pagbili ng medical supplies, ay di yung supplies dapat pag-aari niyan ay DOH.
That is correct, Mr. Chairman. Pag-aari talaga ng DOH lagi itong mga
face
binili
shield?
with APR.
Ba't yung binibili?
Bakit nagbumili kayo ng face shield na binenta ng Blue Cross sa PSDBM na nanggaling din sa inyo ang pera na pinagbili ng face shield? Anyway,
And then, Mr. Chairman, these are additional
gentlemen.
items, Mr. Chairman. But anyway, we will look into this and make a report in the next hearing, Mr. Chairman.
1:30. I think we've run out of time. Thank you very much, Senator Dillon. I was just going to point out that the quantity bought at 120 pesos is 1,317,711 pieces. If you're going to distribute that to 699 hospitals, as reported, or I think that was the value given to me by the number given to me, you would have to give each hospital 1,885 face shields for all the people in that hospital. I don't know whether they can finish that, Mr. President. But the point made, I think, by Senator Dillon is very simple. Kung pag-aari nyo yan, bakit nyo pa bibilin sa kanila yan? That's all there is to it. All right, on that note, the chair would like to thank everybody. We will have the same people who are coming in next week. We will have to do it on Friday at 1:30. We start Friday at 1:30 in the afternoon. Hopefully, we can get purchase on what has been happening here. Certainly, the people need to get their questions answered. I get a lot of texts about that. I'm not trying to rush this to blame anybody. We're trying to be as fair as we can, but the trouble is, there is a paper trail that I'm merely following, and that's all there is to it. So, on that note, Mr. Wang is advised to come back here. I think he went to the embassy already. We will just get a message from the Philippine embassy that he has taken his oath, and we will have him there. I apologize to all the rest of the members. When we start, Mr. Villanueva will be first, followed by Mr. Villanueva will be first, followed by Mr. Villa. Mr. Villa has already asked questions, followed by Mr. Lacson, Mr. Pangilinan, Mr. Pacquiao,
Mr. President,
Ms.
Mr.
Marcos,
Chairman.
Ms. Poe, and Ms. Santiveros, and Mr. Go, Mr. Cayetano, Mr. Pimentel, Ms. Cayetano, I'm sorry, Mr. Pimentel, Mr. Angara, and Senator Villar at the next hearing. That will be the listing. Thank you all very much. This hearing is suspended until Friday, September 10. September 10. This hearing is suspended, and thank you all very much.
Tayo ng pag-compute ng PPEs. Kasi ang